Welcome back to the second season of Minutes Mastery in 2025. From 3T, we wish you a very happy new year. This year, our one message which we want you to keep in mind is, please take care of your physical and mental well-being. इस नए साल में मिलीमीटर अब सेंटीमीटर बन गया है, जैसा कि 3 इडियट्स में हमने देखा था। इसी प्रकार से मिनट्स मास्टरी भी अब बहुत ज़्यादा गहरे कॉन्सेप्ट्स लेकर, यूज़फुल कॉन्सेप्ट्स लेकर 2025 में आपके पास लौटा है सीजन 2 में। When you visit a hospital, does your BP shoot or you become nervous? Or maybe just the opposite, you go in determined to seem fine even if you're secretly not feeling your best? Welcome to Minutes Mastery series by 3T. Today we shall discuss the white coat syndrome and medical masking, the two extremes which can impact your health in surprising ways. Today I went to visit my cardiologist in the hospital and I thought, let me share the white coat syndrome which many of you must have experienced. The white coat syndrome occurs when a patient's blood pressure or anxiety spikes due to the stress of being in a medical environment. This can lead to certain outcomes. 1. Misdiagnosis. Elevated readings might falsely suggest hypertension, leading to unnecessary treatment. 2. Missed insights. Doctors might focus on the immediate symptoms rather than looking at the bigger picture. But there's a silver lining here. White coat syndrome can actually prompt some patients to monitor their health more closely outside the clinic, which can uncover true patterns and risks. Next, let's see what is medical masking. It happens when patients downplay or hide their symptoms, sometimes out of fear of being diagnosed or being hospitalized or having to undergo surgery. They might act supernormal to avoid drawing attention. Then what's the result? 1. Delayed diagnosis, because symptoms may go unnoticed and conditions can worsen without proper treatment. And secondly, inaccurate assessments. Doctors rely on patient honesty to create effective plans. However, in rare cases, acting upbeat can help patients feel more in control. But this is only beneficial if it's paired with transparency about the symptoms. To conclude, both white coat syndrome and medical masking highlight one key point. Communication and trust between patients and doctors are crucial. So whether your nerves spike in a clinic or you find yourself downplaying how you feel, there's one golden rule. Be honest with your healthcare team. Your health is worth it. If you relate to the white coat syndrome or medical masking, do share your experience in the comment box below.